Hey, survivors, for those of you that may be still out there, my sincere apologies for some technical difficulties, but I am going to go ahead and go through the content of this live event. And for those that are still on or signed up for it, I thank you very much. So, what we're going to talk about are employee benefit strategies for groups with 2 to 100 employees. I'm really excited about this. I'm Mark Forehand. I'm with a brokerage firm here in St. Louis. We're part of the Blue Chip Consortium. For those not familiar with that term, we're part of are on the St. Louis Business Journal's list of top employee benefit firms, number one the last couple of years. So with that, been doing this 20 years. This is designed for owners, C-suite executives, HR leads that are looking risk on their employee benefit program and increase performance for both the financials of the company and the employees and the attraction and recruitment game. Okay. With that, I want to set the table. A lot of this is for all groups. Don't feel like a little bit of this is going to be for that 2 to 10, and most of it's going to be in that 50 and above. 90% of this is for all of you. Okay, there is some when we get to some self-funding that's going to be 50 and above, and I'll identify that for you. But this is all about empowering you, all right? In this world of healthcare, especially in your size groups, the 2 to 100, it's really led by the broker. You rely on your trusted broker to bring you ideas, bring you strategies, bring you solutions that help you run your firm, increase your sales, improve your service. Okay, that's what this is all about. I'm kind of coming in that you don't know what you don't know. Know what I don't know about this technology. So I'm hoping you'll get some things out of this to where if you haven't heard of it before, call your broker, call him or her, and just ask them about it. Or you come up to the renewal and you were looking for this one strategy that we're going to talk about today, and you don't see it, ask them about it. Take notes, or if it's easier, feel free to email me or call or text the word notes to my cell phone, which is 314-303-0365. Okay. With that, let's get to it, because I find that size matters. So what does that mean? I find that, if I'm with a new group, a common thing I hear is, I didn't know you could do that. All right. It makes me feel good. I like to educate. I like to bring things that they haven't seen before. But at the same time, it's an indication that groups aren't being served. All right. So let's get to it. I want you to automatically expect a few things in your current broker relationship. Maybe you don't have it now. Maybe you didn't need it. But HR technology is probably the first thing. Okay. LIMRA's 2005 benefits survey had about 29% of groups 2 to 100 that utilize an HR ben admin system. All right. I really encourage it. It's going to give you insight into your population. It's going to help with benefit administration. It's going to help with compliance. All right. It's going to offload a lot of that risk that you have. And there's no investment on your part. So make sure you have some benefit administration. Think of it like doing payroll with Excel spreadsheets. It's really like that. The trend is to get on this technology. If you have 50 or more, you should be looking into taking advantage of some data feed transmittal, which are automatic. It removes the human error. It's really good. Gives the company more of a bigger feel look, kind of raises expectations from your employee base. So that's number one. Number two is I want you to offload a lot of the benefit administration. Okay. If you're a smaller group, no matter what size, it's a pain in the butt when you have a new employee or a termination or a change to get them on and off the different plans. Okay. Offload that to your broker. Their teams do this day in and day out. Free your HR staff to do some more of the strategic things that we're going to talk about. All right. That's going to be a good thing for your company. Also, compliance, and specifically plan documents. I see a lot of groups that will be utilizing the strategies we're going to talk about, but they're exposed because they don't have the plan document that's required under ERISA. I'm going to use that term, ERISA. That's the federal law that kind of governs employee benefit programs. Okay. So when it comes to that, is what's called a POP document, POP. It's for premium only plan. About 71% of groups, 2 to 100, utilize Section 125. What the heck is that? That's when you have employees share in the premium and you pull their portion out on a pre-tax basis. There is a document that's supposed to be in place with a summary plan description that identifies those premiums are going to be taken out on a pre-tax basis. If you want them on a post-tax basis, let us know. It's just something to keep you in compliance. Reach out to your broker. They'll be able to put that in place for you. The other most common is the document that you need, excuse me, when you utilize a health reimbursement arrangement. I'll describe that in detail and I'll talk about that documentation there. But, again, that same LIMRA, they estimate groups 2 to 50, there's about 60 to 80% of them out of compliance. Okay. You just don't want the headache. You don't want a disgruntled employee complaining to the Department of Labor or something else. So then you're audited and this is just something you can have exposure when you didn't need it. Okay. With those administrative tasks that I want you to have included in your broker services, let's get down to some tactics that are going to increase your plan performance. Okay. Going to fight some of these increases that you're getting. The first one is I want you to buy a higher deductible. You've got the renewal. It's ugly. I want you to buy a higher deductible. Even if you get the renewal and it's not ugly, this is a great strategy. Buy a higher deductible, but keep employees whole. Okay. And there's 2 ways to do that. Let's say you have a $1,500 deductible right now. I encourage you to buy at $2,500 or $5,000. If you've never done it before, maybe you start with $2,500 and next year go to $5,000. But let's say, for example, you're going to go to a $5,000. You want to keep employees at that same $1,500 level. So one way to do that is you can buy what's called a gap plan. It's going to fill the gap of the deductible that the employee had in the amount that you bought. Okay, it's a second insurance policy. It's a separate insurance company. You're going to say to me, that sounds really inefficient, and it does sound inefficient. But what you want to do at renewal time is have your broker look at the premiums for the $5,000 major medical and the gap plan that's going to cover, what the gap plan will do is cover the deductible from $15.01 up to the $5,000. It's going to cover the in-network benefit level. So it's a really slick way to do it. It doesn't make sense. And I'll tell you, we're 3 and 4 years with gap plans that have not increased like the major medical has. So it's a really fine, it's a fine strategy. What's the downside? There's a little bit of an education for employees because you've got 2 separate insurance policies, 2 separate ID cards. When you go to the provider, the doctor or the hospital, excuse me, you're going to show both cards and you're going to tell them, file it with the major medical first. After that runs through, then it gets filed with the gap plan. So there is an additional step, but it's a creative way to keep them whole on a net basis. After the first year, people get used to it and the noise really goes away from, the 2-card situation. That's our experience. All right. The other way to do this is with a health reimbursement arrangement, what we call an HRA. And most companies do that over the gap plan, just so you know. Okay. What the gap plan is, it really accomplishes the same thing, but instead of having a separate insurance policy, you, the employer, are going to take on that risk. Okay. For the amount over $1,500 to $5,000 in my example. Okay. And you may say, holy cow, I can't be paying $3,500 for each employee and their dependent. And you won't. It's only going to be costs that are covered by the health plan, that are medically necessary and went towards the deductible. It's not for gym memberships. It's not for, heart scans or something like that. So just be aware. About 25% of groups under 100 utilize an HRA. And I think that bears out when you look at the Kaiser study. The average deductible for small groups is $2,631, and average deductible for large groups is $1,670. I think they're buying that big deductible and then HRAing it down. So what your broker can do at renewal time is show that $5,000 deductible and then give you scenarios based on a best case, worst case and most likely case reimbursement. Okay, that's the HRA. A little bit of added administration. The broker can help you administer it, or you can have a third party administer the HRA. But I did mention to you the second most common compliance issue is an HRA without the plan document. They've set it up, they've communicated it to the employees, but they don't have the plan document in place. That's number one. Number two, a lot of people, this is required to be offered under COBRA. The HRA falls under ERISA. So what you do when someone leaves, if you have one plan, the $1,500 deductible, the COBRA notice will have a $5,000 deductible, and then it will have the $1,500 with the HRA. And there's a factor that you put onto the premiums in that COBRA notice. Okay. Again, this is something your broker will help you with. Mark it down, ask the question if it's confusing you a bit, which all this stuff is confusing, right? So that was bullet number one. Number two on how to fight these claims is to not look at benefits as a one size fits all. Okay. Employees are going to fall into one of two camps. Half your employees are going to say, Mr. Employer, I hardly use the benefits. Don't take any more out of my paycheck. Right? The other camp says, Mr. Employer, these benefits are valuable. Don't raise my deductible when my daughter has to go into the hospital. Okay, put you in a tough spot emotionally, right? So what you can do is don't offer one program, offer 2, 3, or 4 programs. Okay, I have groups of 4 programs. They don't have 2 employees, maybe have two benefits for those folks. But what'll happen is, let's give you an example. Let's say you have a $2,000 deductible today, and you charge $100 a month for that premium. Okay, through the Section 125. So you got that document, right? Maybe you offer the $2,000, but then you offer $1,000 and a $3,000. Okay, the $2,000 has the $100 per pay period that they're used to. The $1,000 is going to be $200 per pay period, and the $3,000 deductible. These are deductible. $3,000 is going to be $50 per pay period, and maybe we throw in dental or vision. That's been a successful strategy. Dental and vision is not big dollars, but it's really high profile. Okay, so that's a strategy you can do. You may want to put a health savings account in as a fourth option, and again, attach dental or vision. So a number of things you can do to massage this. And you say to yourself, well, now when I hire somebody, they have to choose the plan and stuff. That's okay. That's employees getting engaged in medical, seeing that there's a price difference. If you want to lower deductible, it costs more. So it's really a first step on employee engagement. They understand what a different deductible risk is and the price difference associated with it, which is per pay period. They do it with their auto and homeowners, on an annual basis. So anyway, it's been really, really successful. Just as a context, Kaiser in their last study for small groups under 200, that's how they break it out. 66% of groups had one plan, 27% of groups had 2 plans, and 7% of groups had 3 or more plans. I really encourage it. Again, just takes the dilemma off of you at renewal time. Do we increase the employee's cost? Do we increase deductible? You can massage it, right? And also when you go to attract new employees, you've got more possibility of hitting the mark with those people that you want to hire. So, and by the way, with that 2, 3, 4 plan option, you can utilize a GAP plan or the HRA. So a real smorgasbord. So anyway, that was number 2. A couple other things I just want to touch on because they're in the news quite often or headlines in the newspaper. The first one is at ICHRA. That's ICHRA. That's individual coverage HRA. We're hearing more about them. Only about 4% of groups, according to Kaiser, offer an ICHRA with their group plan. Essentially what it does is it starts to set an employer's cost. They're going to set the stipend at $500 a month per employee or $1,000, wherever they want to set it at. And then the employee is to go out onto the exchange and purchase that individual policy. And there's usually a company that will handhold the employee through that. I'm not a big fan. When you buy from the exchange, it's much more expensive for the healthcare. you could have one employee single cost is $600 a month, and somebody else's is $300 a month. So you've got a wide variety. So that 500 could go far, or it could go not far at all. So, but that's what an ICHRA is if you hear about it. The other thing is a PEO, professional employer organization. A lot of companies, a lot of small companies use this. Kind of the entity that's over that is the NAPEO. They estimate over 200,000 employers under 100 utilize a PEO. Average group size is about 23, 83% of them are less than 50. It's kind of the easy button, especially if you're starting up a company, you don't have HR, you got bundled 401k, benefits, compliance, payroll. It's all in one nice, easy package. You're actually a co-employer with ADP or Insperity or Rippling or JustWorks. Okay, that's what a PEO is. So you have co-employment. But it's nice, and at times it's really good for employers if they're in high growth mode. They don't have a dedicated HR team. Really makes sense. As a group gets more mature, sometimes the season for a PEO changes. Maybe you don't need a PEO, or a lot of groups don't know if you're on a PEO now, you can look at ADP without the benefits. They call that laddering down. So it's not an adversarial situation because a PEO, their benefits are fully insured. Okay. We're about to talk about the benefits of level funding and self-funding. So to look at benefits outside that, you look at it on a level funded or self-funded chassis. And again, it's just a tactic, a strategy that the broker should review as you go each year. Just take a look at that. But don't feel like if you love the payroll, you love the 401k, the employer practice liability, just know that you can pull the benefits out and keep all that stuff if you want, or you can unwind the whole thing. A good broker can help you with that. Okay. Let's see. With that, I think that's a good point to lead us to level funding and self-funding. Okay. What is the difference? This is really starts to be the true way to start to manage your costs. All right. Let's give you a little more context with KFF's study from 2025. Groups 10 to 50, 56% were fully insured, 44% were either level funded or self-funded. If you look at 50 to 200, 43% fully insured, 57% level or self-funded. I think it's important that you know where level funded came from because it wasn't an option before the Affordable Care Act. All right. There wasn't anything the insurance carriers wanted to do. Start giving claims, have the ability to get a premium refund. All right. What happened was with the Affordable Care Act, Obamacare, whatever you want to call it, it required small groups to access medical via the exchange. Okay. What's a small group? For most of the states, it was under 50. In Missouri, it was under 50. Some states like Illinois, it was under 100. It required them to buy their group from the Affordable Care Act. However, embedded in the Affordable Care Act was the requirement that self-funded groups, it didn't apply to. Okay, so you can see what happened. Okay, Affordable Care Act, those small groups, there was no underwriting. Okay, there was no pre-existing condition, which was a good thing, but it was and is expensive. All right. When they went to, when these carriers said, I don't want to lose all that groups, especially the healthy ones, we're going to develop a self-funded product and we're going to get back to underwriting. All right. Hence, level funding was born. It looks and feels like fully insured. It's got the premiums, it's composite rate for single, family, employee, children. You just pay the number of employees that you have. It doesn't vary by how much claims. If you have a bad claim year, you don't owe any more at the end. You just get a bad renewal like you do on a fully insured basis. You do start to get some claims information. And if you run really well, you can get a refund of the premium. Okay. United Healthcare has been doing it the longest. They cite, if you remember, their first one was All Savers. That was their sister company. All they did was level self-funding. They would start at 25. They cite about 38 to 42% of their groups will get a premium refund. So take that for what it's worth. But that's level funding. It's funny, Kaiser, if you look at their 2025 study, it looks and feels so much like fully insured. They say most of the groups, small groups that are on level funding, they don't know it's level funding. And here's how you can tell. Here's the quick way you could tell. If your rates are age banded, meaning you've got a 20-year-old and a 40-year-old, they both have single coverage, but the rates are greatly different, you are fully insured. Okay. If you have that 20 and 40-year-old single coverage and they have the same composite rates, the same rate for single, everybody on family has the same rate, you have level funding. Okay. That's the easiest way to tell. So be aware of that. That's level funding. Really no downside to it, except I find a lot of small groups have no idea that they're self-funding, so they're not in compliance with ERISA. Most recently, the Affordable Care Act reporting, March 1st, employees were to receive that form, that 1095, showing that they had coverage during what months. That was your responsibility. Come March 31st, you've got a electronic file that needs to go to the IRS to be in compliance with the level funded plan. In July, you've got the, now I'm not going to remember the name of it, PCORI, the PCORI fee. Your broker will help you with these things, or at least they should be helping you with these things. So there's a lot more responsibility. You become the fiduciary when you're level funded on these level self-funded plans. Fully insured, it was the insurance carrier that took all that. It was the insurance carrier that took on that liability of being the fiduciary. Okay. Why would you be fully insured instead of self-funded? There's two reasons. One, maybe you've got some high health conditions. All right. It's a sicker group, and you've asked your insurance company your broker has asked for a level funded quote. They came back and said, no, they don't qualify. Okay. Well, if they shared that with you, then you know there's nothing you can do. Okay. The second reason is size matters. You're small, your broker's not in touch. The renewals are coming. They're just pushing them out. Because here's what happened. A couple of years ago, level funding was restricted to groups 25 and above. The last 12, 18 months, it has ticked down. It literally went to 15, then 10, then 5. And most recently now it's down to 2 lives that you can be level funded. So if your broker's not paying attention, that could be the other reason. But regardless, you should know why you're fully insured versus level funded. And we have fully insured too. There's nothing we can do about it. We ask each year, but just no luck. So that's level funding. Next, let's talk about true self-funding. Okay. This is going to be more for the 50 and above, but it's the real, I wouldn't say holy grail, but you can start to bend the curve, as they say. You can start to really affect your claims. And here's why. Just think about it from a human nature point of view. If you're fully insured or level funded, it doesn't matter what your claims are going to do throughout the year. It'll matter at renewal time, but people don't have that connection. You feel like I pay the premium. Employees ought to go to whatever doctor they want, whatever hospital. If we got diabetes, there's nothing we can do about it. It's between them and their doctor. When you become fully self-insured, and every week from your set-aside bank account, claims are being drawn. If they don't get drawn, you retain it, right? So when it's drawn, it affects the financial performance of the company. When you're truly self-funded, all of a sudden, ownership, C-suite, HR leaders, how can we affect these costs? How can we help people with chronic disease? How can we help people with musculoskeletal, with diabetes? All right. Now that becomes a focus because you've got a vested interest. I use the analogy of you're going to throw a reception. So you talk to the caterer, and the caterer says, hey, it's $25 per person no matter what you put on the menu. Well, you're going to have a heck of a lot of steak and lobster, right? Versus if you sit with the caterer and they say, this is this price, this is this price, you're gonna modify it based on budget, based on what real value is, what's too much, what's too little. So self-funding is like that. Some of you are sitting out there and saying, self-funding, I don't want my business exposed. just know this. Here's the bottom line. Just know this. You can structure self-funding with all the protections of like a level funded to where it looks and feels like your fully insured premiums. But what happens is if you want to decrease your risk, you got to increase your premiums. Okay. What are your premiums? Let's talk about the components of a level funded arrangement. You've got a TPA, what's called a third party administrator. They're the ones that are going to pay your claims. Claims get submitted here. They will usually rent a network. Cigna's popular to rent. Aetna's a nationwide to rent. If you're self-funded with Blue Cross, you're using the Blue Cross network. United, you're using the United network. So there's a network. Employees are still seeing the same providers. This is behind the scenes. Claims get submitted. Claims pay out of your bank account. You're seeing them. You're engaged. Okay. Well, I don't want to have $1 million claim and it risks my business. Okay. And by the way, it's going to come. Those $1 million claims are going to come. They're more and more common. What you can do is the TPA is a fixed cost. No matter how many employees, there's a TPA fee. The pharmacy is going to be a variable claim, and your claims are variable. But there's things you can do. It's called reinsurance. Okay, reinsurance is the protection for that $1 million claim. Someone has an ATV accident. Someone has a preemie baby. You have protection for any one claimant up to a certain level, 15,000, 25, 50,000. Depending on your size groups, there'll be recommended amounts. Okay, if you take on 50,000, that premium is going to be less than 25,000, right? Because you're taking on more of the risk. That's an individual stop loss level. You've also got protection if the whole group goes haywire. That is called aggregate stop loss. Okay, that's for the whole group. Each year, the reinsurance company is going to say, our actuaries, based on your population, your claims experience, we believe claims are going to be $2 million. Okay, but it's not an exact science. And so you as a self-funded company, you're like, okay, I understand there's going to be some variance and I'll accept that, but only to a certain level. And usually that level is 20 or 25% above that level. So if they expected your claims to be 2 million, but they can vary at 25%, you'll take risk up to 2.5 million on the claims. Once claims hit 2.5 million for the year, you don't want any more of it. So that is your specific and aggregate stop loss. That's a big part of your protection. Spec and ag. If you say that, you're going to sound like an industry geek like me. Spec and ag, that's your reinsurance. Okay. Let me talk about some things that you can now, because you have a vested interest and you're really into this to try to control your costs. Here's some things other groups are doing. One is a captive. When you have a captive, maybe you're fearful of buying a $50,000 or $100,000 stop loss. It's a little too, it's on the high end for you. But when you pool, your resources, maybe you're more comfortable taking $100,000 or $150,000 level. So the premiums drop down. And when somebody does have a claim, it gets spread amongst everybody. It's not as true as if you were on your own. You control your employees, you control the benefits you offered, the things you put in place, but you're spread out. So if somebody's kind of a wayward company and they don't care about the risk as much, you got that's involved. There's an additional layer of fees. It's not inexpensive. Be aware of that. You've also got things you can do around the pharmacy. If someone has an expensive pharmacy, you can source those internationally. Take advantage of some patient assistance program. And again, when it's your dollars, you're having somebody oversee those claims and making sure if somebody's eligible for those dollars, they're being tapped into, because otherwise you're just going to pay for it all. Okay. You also hear about direct primary care or direct contracts. You see self-funded do that. Only about, with Kaiser's study, about 8% of groups have direct primary care. Their employees have instant access to a group of physicians. It's quality. They're spending quality time with them. They're not having to wait 4, 5, 6 weeks to get in to see a doctor. That's direct primary care. But probably The one strategy, I've seen no other strategy work like this, and it's a vendor that has, we call it a flexible 5 plan, ERISA plan. What it does is one plan is your major medical, which all of you have. That's the one where you can have 2, 3, 4 plans. That's your major medical. It's the main plan. But if someone's got access to spousal coverage, that's a plan to where, hey, if they take the spouse's plan, you're going to reimburse them and their families out-of-pocket costs, and there's going to be no charge on the payroll. Medicare, someone has Medicare Part A and Part B, they don't want to leave the group plan because they feel like maybe it might hit a donut hole or something. Medical's confusing. I'd rather have better coverage. That's driving up your costs. Your average age is going up. Your reinsurance is going up. If you can set up a plan within your ERISA document that will reimburse those people with Medicare Part A and B, takes care of all of their out-of-pocket costs, they're happy as a lark. They're getting better coverage than they had before, and you've reduced your risk. Finally, you've got it if someone has Medicaid. You may have somebody on Medicaid that they oftentimes stay on the group plan because providers only accept, there's not a lot of providers that accept Medicaid. So what we do is we expand their provider network to all of the PPO. We reimburse those charges 100%. And now all of a sudden they'll take Medicaid and you'll reimburse those out of pockets. Makes all the sense in the world. Proof is in the pudding. 10 years. Renewals have been sub 3%, 10 years running. St. Louis average premium per employee is over $16,000. Factor in the families, the singles, over $16,000. Their cost per employee, $9,000 per year. It's working. It's working because it's people looking at the trees, not just this big picture. They're really diving in and seeing where people have access to other coverage. With that, that's really all I got. Again, apologize for the technical difficulties. I hope I haven't kept you too late, but I thank you. Call me, text me, email me with any questions. If you want the notes from the program, I will be happy to send those to you. I wish you the best. Be better consumers. This is a big dollar item on your books, I know. So thank you for listening.